you very much. I'm really honored and happy to be with you. Uh, as a physician from Pakistan, and Pakistan, is a third world country. Living in a third world country and experiencing poverty at a very different level. I think what really makes, if anything comes out, that start making you humble. And somebody like asked me, "Hey, how are you?" And I was, "Oh, good." And he said, "What's so good about it?" I said, I got up, I was breathing, and rest of my family is breathing. We have no health issues as of now, and this is the best thing, rest I can handle. So that's how I look at life. That's how low my kind of baseline is. And from there I start, and then everything becomes fun. And so today we'll go through a small journey together and try to share some experience from that part of the world. So before we go,
my shot, baby. Instagram now. I think we should just call up Kanye. Kanye or Kardashian now. Rob got fat and bruised and turned into a woman. I'm worried about Kanye. Barbershop, rated PG-13.
Play clock at 5. Pass is intercepted at the goal line by Malcolm Butler. Unreal. Malcolm Butler, who almost made the phenomenal play that wound up in Percy's arms. There were flags on the field for a celebration. Amazing. Butler, a rookie free agent out of West Alabama.
They try to pick play out. They tried to go here, but he beats him to the punch. And I'm sorry, but I can't believe the call.
Me neither.
I cannot believe the call. You've got Marshawn Lynch in the backfield. You've got a guy that's been borderline unstoppable in this part of the field. I can't believe the call.
And there's Brady. As demonstrative as Everett and Richard Sherman.
anybody remembers this?
Breaks up the play. It's still not on the ground. It's still not.
Yeah. What was that? I suppose a dummy like me who came to this amazing country 5 years ago, and instantly my first love was this game of football. Huskers is my new lady. I am a big fan of Huskers. But this football is my love. And I just love this game. This is amazing. A cricket lover instantly. Oh my God, this. What was that? This was Super Bowl being played in 2015. The best of the best. Probably it's a small statement. They are playing that game. And the best of the best, in those last few seconds, a ball was thrown, intercepted. Best of the best brains, best of the best human bodies, they are doing that. A dummy like me went to the office next day. Why, he was throwing this ball. And I was so wise, and so was the rest of the world so wise. Why they were throwing, they could have done that, they could have done that. Point which I'm really making here is, in this world, retrospectively, everything is so clear. Everything is so nice. I'm the wisest person, I'm the best brain in the world because I can look at that thing few seconds later, few minutes later, few hours later. And even today, people probably talk about those few seconds, forgetting who was actually doing that and blah blah. When it comes to medicine, the best thing is to look at what people have done in different parts of the world. It's not necessary that you try to do the same mistake and learn from it. I'm a proud Pakistani American. This is my home, this is my country. I learned this lesson 10,000 miles away. And the point here is that I share my experience there. And today, we can retrospectively look at that and don't throw the ball the way they threw that ball a few years ago. This is a little bit of what I have been doing in my life. So yeah. That's how we started as a country. So this one big map which shows this our big brother, India. And we took this small part away from them and we became Pakistan, a separate country in 1947. So this is this part of Asia. We have China there, Afghanistan there, and I suppose a lot of people know the region I'm talking about. Just to really zoom in a little bit more, this is where my hometown Lahore is. This is where I used to live. This is the area which we have what you call border with Afghanistan. And if you think through, everybody must have known the name Peshawar. So this is the city Peshawar, and then this is our capital Islamabad. So just to create a perspective where we are going. So we zoom in a little bit further. This is what the FATA, this is another troubled area. You keep on listening about it, and where actually we had started having a lot of polio cases coming. And again, this is very close to Afghanistan. And this is an area what we used to call Azad area, independent area. And even during British rule, even during Mughal rule, this was an area which was hard to rule. And I'll show you why it was hard to rule. And mostly the governments let these people rule onto themselves, and they used to call it independent area, Azad area, even today. Beautiful. It's a Rocky Mountains, beautiful area. But you can understand, if there is no infrastructure, how can any government can have any writ onto that area? Another view reminds you of what? Any area in the United States looks like that? Yeah, right. So something like amazing, just amazing, beautiful. But then, if in that area, here we complain about all the amazing roads we have, our potholes. I'm so unhappy with those potholes. You see, we complain, we all complain, right? This is probably the best possible thing you can have. This kind of dirt road is, if that is there, leveled, and you can actually probably drive your Jeepster on it. Probably this is the best thing that can happen in that area. This is the type of truck culture, and these roads, they are very rare in that area. So this is what you call truck culture, which is there. And then this beautiful area, which was self-governed, was going on well, something happened.
Because of the population density, because of the sanitation, it's like a 5-star hotel for the virus.
इसका बुखार बहुत तेज था। जब वो डॉक्टर से वापस घर आया तो दोनों पाँव उसके काम नहीं करते।
तो कहे अल्लाह देशो बखपल बदन न हो रहेगा पल बदन पल।
If we do not take care of the virus, you can forget about the eradication.
थे पोलियो वर्कर्स घर घर जाकर बच्चों को जिंदा पोलियो के कतरे पिला रहे थे।
3 people were shot.
यहाँ पे जो है ना बाजी मेरी आई है, उन्होंने दरवाजे को दस्तक दी है, ये फायर हुआ था, ये यहाँ पे।
All 3 are died. That's just not supposed to be a war. These killings come from misconceptions.
The threat to the polio workers is a huge problem.
If it continues like this, then there is a risk for the country and there is a risk to everywhere else. To kill the perception of those who want to do harm. It's a very difficult task. It is not an impossible task.
ये program, ये तारीखी है.
The security plan is more robust than anything that you contemplated in the past.
The survival tool the para jang di.
आसिफ इंशाल्लाह अपना मिशन को जारी सारी रखना।
और इसमें हम मुकम्मल तौर पर प्रोटेक्शन देंगे अपने राजा का।
हमारा मसीह उठाया के पावर के साथ खड़े हो जाएंगे।
You proved everybody wrong by going back and redemonizing those children.
इंसान जिंदगी तक सीधा लगा हवा चिट्ठी रशिया कभी दुनिया बड़ी हम ना पा दुनिया में इंशाल्लाह होगा
और जो लोग इन्हीं जानते कि बीमारी खत्म हो, वो लोग इंशाल्लाह नाकाम हो जाएं।
So this happened. Polio, we had, that we got rid of polio from this globe. This came back, and Pakistan was the other country where we were having polio beside Nigeria and Afghanistan. And it was really hard to understand how can this happen. You saw how crippling that disease is. Once it gets in, it gets in. There's no cure for that. The person, the baby, and ultimately the adult, they have to live through that. Everybody knows that. It's not a new science, it's not a jet science, nothing. Everybody knows it. Why people end up not letting their kids have 2 drops and save from this deadly disease? So for medicine, medicine is obviously a science, a huge science. But we as humans, we always do things which are very common sense things, which are very socially oriented things. And why this was happening, we need to understand the people who are living there. If we understand the people, then we can understand why they were doing this. Nothing, to my mind, nothing is illogical in this world. I may see that something illogical is happening, but if I talk to that person, he will have tons of reasons to say that what I'm doing. Somebody who smokes, he smokes or she smokes. But if you really go, I have no answer for that, even today as a doctor. It makes me happy. Oh my God. If something makes you happy, there is no other argument. We may find it illogical, but point is, he or she has a point. So why they were doing that? Just to really to recap and understand social side of the polio. The area we talked about, there are kind of 4 tribal regions, and Fata is one of them. 10 districts, and within that area, that small area, 83% of the polio reported cases in this entire world are just there. So the issue is not with the rest of the Pakistan or the entire Pakistan. If we think that, and by the way, Pakistan is obviously is a small state. We are not talking about the globe world. So all right, let's think that Pakistan is this one big world which is there. Within that world, there's a very, very concentrated area where this issue is taking place. And we know as scientists, the reason why this is taking place is that kids are not getting polio vaccination. And we understand from scientific point of view that this virus is there already. So if you start opting out not to give vaccine to somebody, what we call this herd immunity, which rest of the pack has is some kids who are susceptible, the chances of getting that disease goes very high. And this is what was happening. And you have this one case of polio. This is good enough to have tons of them. This area, we saw that this is least developed. Hardly there's anything they can grow to make a living out of it. When it comes to internet, just forget it. Even in the best areas in Pakistan, if you have internet access, you are privileged. It's not that you'll go sit in some coffee bar and have internet going. So that's not the case. Interestingly, in that part of the world, cellular density is one of the highest in the world. How much on an average you pay for your cell phone on monthly basis? Anybody come up with some figure?
$50.
$50, and then you start adding data and everything. You know those things that keep on selling. So on an average, I'm talking about, this is a family package. Talking about $80 to $100. Family thing, $200 for 2 kids and 2 parents. This is what mostly happens. Very expensive. Here, I can have a cell phone operating round the month for $1. If I'm not making calls, even if I'm making calls, like if I'm spending $3 to $4, which is still not a big amount in that part of the world. So this cellular density is highest. A population of 180 million and the number of connections sold, they are probably equivalent to 180 million. Can you believe that? If you start taking out kids, and because now everybody's getting 2 or 3 connections in their pocket. Cable TV, very expensive here, very cheap there. Why is very cheap? One will have a dish thrown up, and he will then supply this entire village with this cable connection. He's not being charged anything, and probably he'll buy this one card to get let this kind of ESPN running and HBO running, and the rest of the world can enjoy that. So it's free. So they can get cable TV for maybe $2 to $3 every month. Here we end up paying $100, and then we end up buying more movies on it. So poor. But there's another very important thing is. They are very lowly educated. I cannot really relate education with prosperity, but in this area, it is the case that poor, very, very lowly educated, and males, that is the world. It's a male world. It's a privilege to be male in that part of the world because everything revolves around it. Every rest of the things, as if there's no other gender exists for that. So that type of, and when I talk about male-dominated society, this means the head of, even the kids, they are not considered a human being till they grow up and they become males themselves. So in this area where there's poverty, lack of education, one segment of society is dominating rest of the world. Religion is a big thing there. So you see, when everything is going wrong, people find some respite somewhere. And they are trying to find religion. And they boast about it, they feel good about it, they brag about it, we are religious. And from where this religion is coming? Guaranteed, 99.99% have not even read the holy book, Quran. And they get all that information from this Maulvi, who is the custodian of our prayer areas called mosques. So in that part of the world, there's one mosque, which is this one Maulvi who is there, and whatever he is saying, or whatever sermon he is giving, that becomes the religion or religious information of that part of the community. So what happened? So this type of community which is there, and just think through that there are fathers, there are mothers, they have got kids. How much we love our kids. I'm absolutely sure. I'm not I have no iota of doubt in my mind. If required, and I need to do something for my kid, even like risking my life is a very small thing. It's a non-brainer for me. I'll just go ahead. Here I go for my kids. I do whatever it needs to protect my kid, to make them happy, to keep them going, and their happiness is my happiness. And I'm sure this is what all the parents believe. And whatever my information says, as a father, how much you love your kid, the mommy ends up loving their kids few million times more. I'm not kidding. I'm a father, and it makes me very, because she's not around, so I can say this, and otherwise, So I've got a little one who is 3-year, Alexander, and I love him, hug, do everything. But I know the level to which my wife can go, or I should not say my wife, the level to which Alexander's mother can go, that is unimaginable. She's the mommy, and we all share this. We all share this love, affection, and connectivity with our kids. We are humans. So these people who are poor, uneducated, living in different conditions, but one thing stays the same. They are the same machine we are. They are humans. And their emotions, they are the same. So why you think a mother, let's talk about mummies for a while only, why a mummy is making a decision to let her kid exposed to this type of danger? Why do you think this is happening? There must be a very valid, solid reason. For that mother, for that smoker, it makes me happy. For the person who really just keeps on, I just enjoy it. Go ahead. I mean, this is the best thing. I need to get drunk to my bones. I enjoy it. Oh, fine. I mean, that's your choice. But these mothers, they must be having some logical reason why they're coming. What Taliban did. These terrorists, there's another name for, these terrorists, they're called Taliban there. They said that we need to educate these mummies in a way that they run away from this vaccination. They came up with two things. One, this vaccine is making their girls attain puberty earlier. Two, this vaccine is making their male issues sterile. So in a male-dominated society, where you think if they fear that the male issues will not be able to produce kids in the morning, that is their family line will stop somewhere, and on top of it, the girls they are becoming younger at much faster pace. This is kind of a very logical, valid concern they put in. 3, bring religion in. They declared that this vaccine is, and Melinda Gates, this organization has been amazing. They have donated all that vaccine. In Pakistan, we get the vaccination for free. How much we charge here for vaccination? Any dollar amount you want to tell us? No? All right, I tell you. It's like on an average, it's kind of, how can this is possible in this part of the world? Like $60-70 is like kind of nothing for a polio vaccine. Is it? On an average, this is the kind of bill with that comes. So if you go through the package and everything, it's like $200 plus it gets in. In Pakistan, it's for free. 1, 2, you need not get out of your house. They will come to your house and deliver vaccine. So cost is not an issue, poverty or education is. So they made them believe that this is bad for your kids. 2, it's un-Islamic. Yes, please.
Oh, I'm sorry. I don't understand what the ostensible motivation of the Taliban. Why would the Taliban do this?
Yes.
Why did they start doing it?
Yes, we'll come to this. Let me kind of that's where I really want to go.
Okay.
Because how I look at life. I try to read the people who have been successful in life and try to understand. And by the way, in our part of the world, there are a lot of politicians who are corrupt also, very corrupt. And I said, why you're trying to? I said, you see, in this 180 million people, where everybody is dying of poverty, why this man is making tons of money? I will learn at least one thing: what not to do. You see, what not to do. Knowing what I will do is a difference. So that's how I'm trying to really come up. So one is they kind of started working on the brains of the people. Second thing they did, if you look at this thing, to do a polio vaccination, what you need a vaccine. They have no control over vaccine because that is coming mostly from United Nations. Melinda Gates is one of the big donors for that. So they can't even stop that vaccine getting into the country because the government of Pakistan is also doing that. Once a vaccine gets into that country, that has to be delivered to those children. What they did, those people who were carrying this vaccine to those people, houses, they started attacking them and started killing polio workers. Polio vaccination workers, they started killing them. So if one worker gets killed, second worker gets killed, this kind of fear that sets in, and nobody is then ready to go there. Number 3 thing they did, they started talking to these males. Said 1, it is un-Islamic. 2, if we come to know that you have got your kids vaccinated, we'll come and kill you. And actually they ended up killing few of the kind of males of those families. So what they did, they worked on the thought process, they cut their supply chain. This is kind of this delivery system, they stopped this delivery system and the vaccination started going down. And why they were doing that? Logical thing is, if their part of the world is getting healthy, why they would stop it? Because ultimately a few of them will again become part of their kind of what you call army, rather than they are making those kids go sick. This goes back to how Osama was captured, and this kind of this theory, things go about how he was kind of traced was done through polio workers, because polio workers, they were going from home to home. That is where we were able to pick up the DNA of Osama, and then he was tracked, traced, and ultimately killed there. So this is this one, revenge coming for that. 2, they're trying to create this anti-US sentiment there, which is kind of helping them, because you just go, illiterate people just go and tell that through this vaccine they're trying to destroy your future generation. These girls will grow up, will become mature very fast, and they will be exported to that part of the world for fun and frolics, and your males will be sterile anyway, so you'll die out in few years, you won't be here anymore. So this was this thing that was fear and then breakage up of supply chain. They did this and stopped this vaccination. Result as of today is, how much time we have? Okay. So the result of this entire game is, vaccination is still as of today not going as effectively as should have. We have a lot of kids who are coming up in this world and not getting polio vaccination. I know the reporting system in that part of the world. Not every case gets reported. I'm sure there are a few cases who go unreported, and we saw this. We have a region just across is Afghanistan. So people across Pakistan and Afghanistan border, just like that, it's kind of very, very porous. Even if you want to, you can't stop them. All those rocky mountains, you just cross. And how many cases they are in Afghanistan which stay unreported and they're moving to and fro, and how much more polio infection is taking place. Just think. And they did this by just creating false fears. So the reason I'm here is, and I'm a public health professional, and what we really try to do is, we really try to talk about is, we spend $3.63 trillion per year on health industry. The reason I say health industry, one of my major roles in Pakistan, I'm a physician and an MBA, and I have worked for quite a few hospitals and pharmaceuticals looking after their business side. And I kind of believe that for every good reason, for every good wish list, ultimately reality is we need money to do that thing. As a healthcare professional in United States, that's how I look at it as a public health professional. 3.63 trillion goes in every year, and as of today, we are 17th in the world, in industrialized world. They're around, at times they look at 20 countries, at times look at 30 countries. So right now we are 17, sometimes we are 20. If they start counting 30 countries, we are mostly somewhere 28, 29. Our health indicators, they are not there. We spend, out of those $3.68 trillion, we spend 8% on primary health care. And this is public health, where we talk about prevention, we talk about those things. So the lesson here is that if polio vaccination is not done in any part of the world, it has its consequences. So my belief is that we need to have those vaccinations going on, and we need to support as a society that we keep it going, because those kids who are not getting vaccinated, they're not only carrying a risk for themselves but for rest of the kids around them. That's one lesson. Number two thing is, now interesting, if they are trying to beat this area through religion, what should be done? Beat them through religion. So what they did, she's sleeping. She went to India, did her polio. She was part of the polio drive there in India. So anybody who has made a visit to Nigeria, they know what they started doing this. This experiment was started in Nigeria. They started using these Maulvis, these religious leaders, and started talking to them. Not only talking to them, making sure that some of that money also flows to them. And they brought them on board. Said, look, this is scientific evidence. This is all false, which is going wrong. So you need to go and talk to people. Because by this time, everybody was clear. Internet connectivity is not there, cell phone is there, or some cable TV. So those mothers have no access whatsoever to any information. So do what? One, try to talk to those males, and where those males are going. They are going to mosque for prayers. So and they believe in that Maulvi. Brought them on board, used mosque as meeting points for dissemination of information. You know, in Muslims, we are supposed to pray 5 times a day. Preferably go to the mosque. If not, that's still you can pray at home. But for these Friday congregations, it's a must that they get together in a mosque. So they started using those Friday congregations to disseminate this message through Maulvis, and told them that this is absolutely Islamic, this is absolutely okay, go ahead, start vaccination. So they were used, and then the other area that thing that is happening is in those small areas. Obviously, just think through any group of humans living somewhere, they'll always have some leader who is there. In that part of the world, which has a lot of weapons, which has a lot of cocaine, heroin, and obviously, if everybody is poor, then what all these weapons and cocaines they are doing? Why they're producing all those weapons, and why they are having all those heroin in the world? Where that money is going? Obviously, that's a few $1 million industry or a few $1 billion industry going on. These are these sardars who have, or the tribal heads who have kind of control on these two trades. And at times, government keeps what you call a silent ear to them, and they keep on doing what they're supposed to do, and neither they're controllable. So they talk to these sardars. They said, look, you really have to get on board with us. It's a win-win situation. So you come on board and try to talk to your males. So they started talking to their males, and that's how things started reversing, and now the situation is a lot better, not 100%, but the situation is a lot better. And then obviously, in this area where we have high cellular density, we started using text messages, which does not make people here think, oh, text messages in that part of the world. So they can use it, text in local language. It goes out, which is very high coverage. And then we are cricket lovers, so they used cricketers. They were used as model. They were there out there, kind of motivating and trying to get this polio thing to come. So I will stop here, and I would request you to. We can really talk a little bit more about why Taliban really. Yes, please. Yeah. So, are you comfortable? We talked about.
Yes, now I was just curious why in Afghanistan, why the problem is not more widespread. I imagine Afghanistan to be more Taliban controlled even than Pakistan.
That's right.
Is it spreading there? Is it?
Yes.
What mitigates against it there?
One is when it comes to reporting system. I cannot say as per the documented reports are the polio cases, they are being reported in Pakistan. So I'll stop here. I will not go beyond that what is not documented. But my fear is as a healthcare worker that undocumented cases are taking place. This just cannot happen because if the conditions are same, I'm trying to kind of build that logic which is there. They have got the same vaccine which is there. They have got the same kind of what you call value chain which is going on, right? In Pakistan, Melinda Gates, all the vaccines come through government. They are transported to those workers, and the same thing is happening there. So whatever they are able to do here, they are able to do it there also. They are clamping it. They're clamping this. They were able to clamp that, and I don't know why. I agree with you. When it comes to documentation, I don't see that. Number one. Number two thing is, I kind of believe I can talk about my home. I can talk about the issues which are there, and I understand. What is happening with my very nice neighbor, since I don't have first-hand information or that cultural connectivity with that, I should not make a comment. I can talk nice things about Afghanistan, but I should not say anything about Afghanistan. They must be doing well. I don't. Yes, please.
Before one would jump to an irrational approach, one could turn that around and say, what is the motivation for not doing Medicaid expansion? What is that motivation? What is the political advantage of doing that? It's control, probably, you know.
Medicaid, it comes to this part of the world, and yeah, so you see, I should not make any comments. I tell you, I can share with you my experience. Again, I have seen poverty to that strange level. I was working in ER one night, and it was around midnight. You know that when you're working in ER, at least this was an issue with me and friends, and the time between 2:30 to 4:35 is very difficult. I don't know what your experience is. I was, oh my God, I couldn't see anything. Everything was kind of gray to me, and I'm going through. I have to perform, especially if you're there in the ward for last 3 days. Just think through. During those times, there was this one mother who came to me. And issue was that probably a lizard. She was trying to boil the milk, and she gave milk to the baby. And by the time she realized the baby had drunk the milk, she saw a lizard dead in the milk, and she was kind of very scared that something wrong can happen to the baby. So in that part of the world, hospital corruption is there. So doctor is there, building is there. That is for free, by the way. In our part of the world, you walk into government hospital, it's for free. So mostly we don't have medicines or tests. So I wrote this one medicine, which would have costed maybe 50 cents. I say, hey, can you go out, get me the injection? Because you go to any pharmacy, show the slip, and they will give you the medicine. And not like that. We have this issue here. So she started crying. I said, why are you crying? Because I was in a shock. What's wrong? And she said, I don't have money. So just think through. My heart sank. Because at that time, that mother was convinced that it is a life and death situation for her baby. And she did not even have 50 cents in her pocket to go and buy that injection. So that level of poverty. So what we used to do as physicians, they would always have these samples and everything, they would come. So we'll keep them in a cupboard. I rushed to that cupboard, got that injection, gave it to the baby. Baby was all right, nothing was, so it was a happy ending story. But point is, there, legally, anybody who walks into a government hospital will get the treatment for free and get out. You can actually get an appendectomy done in a government-run hospital, successful appendectomy, literally for $20. And that is again courtesy corruption, because you need some medicine, you need some tests. Otherwise, they get in, get the operation done, get out, absolutely free. Stitches go out, bopped, they're good to go. I'm not used to saying no to anyone. If you are rich in Pakistan, and there are people who are rich, yes, you want to have kind of this first class or countryside treatment, all right, you go to that private hospital. It's air conditioned, nice fancy rooms, amazing bathrooms, neat and clean. Get the treatment. You can get the same appendectomy done for $2,000. Somebody can get it for $20 there. So there are a lot of people who make this option to go there. But point is, this is beyond my kind of comprehension as a physician, that I can say no to someone because you don't have insurance and you go away. Or if I give treatment to someone who reports in ER, thank you very much, blah blah, you're good, and 3 days later I receive a letter where I'll be declared bankrupt and gone for the rest of my life, because there's a bill of $24,000 in my, and if I don't pay that money, I'll go bankrupt, and then I cannot have an account, I cannot have a job. You know what happens in. So if you ask my opinion, it is a very hard choice for me. I cannot say no to my mind. Healthcare is kind of very basic thing. It's like air. It's like how can I ask somebody not to have a look at my beautiful flower? It's there. It's for everybody. It's for this world. So similarly, I look at healthcare that way. So I don't want to get into that Medicare, Medicaid thing, but it really makes me sad. Yes.
Do you know if when the U.S. military and CIA made the decision to use polio workers to try and search for bin Laden, were there any health professionals as part of that decision-making who would have thought about the consequences? Because I can understand people connected their anger afterwards that the polio workers were used, that they wouldn't want polio workers used in the future to find other people. I mean, I can understand the consequences. Do you think those kind of consequences were thought about by the U.S. military or CIA?
One thing, the official thing is that it's still a theory. It's still a theory how Osama was, because this is the theory they believe in, and nobody else officially accepts that. So they kind of they are living in this thing, and they are believing in this thing that because of this polio thing, polio testing and all, so they were able to track Osama. I can share hard facts with you, where he was living, where he was killed, the city where he was living, and what type of thing. That, I must say that good thing happened in a city which is what you call military base of Pakistan Army. A training academy is there, Kakul Training Academy which is there. And where he was living, Kakul Training Academy is 1 mile away from that thing. I've served as a physician in that organization, and I have been in that city. There's a saying, and it's true, that not even a single leaf is left unseen by the Secret Service of Pakistan Army. I cannot believe that they did not know it. I just cannot believe that he did not know it. I think for whatever reason he was ultimately sold. Here is it, go and kill him and we'll keep our eyes shut for one full night. Came in, killed him, get out. We are good as a country, the world is good as a whole after that. So this kind of theory that he was picked up through polio workers, and so you see they have to come up with some story, some facing, something. They're irrational. You know how they end up recruiting all those kids for their brutality. They come to a family who is finding it hard to have food on the table every night. They might be having 6 or 7 kids. They'll say, all right, to get this $3,000, and they have never seen probably $50 in one go. $3,000, you give this kid to us. He'll be well fed. You'll get this money, keep it with you. And there's a bonus thing is that if somebody around you try to mess with you, we'll fight on your behalf. This is kind of a lottery that comes up for that poor family. So that's how, at times when you're poor, you make strange decisions. So that they let this kid go away, and then this go away. Like, just think through, as of today, $3,000 is like what? But for them, it's like they can never even imagine in their entire life they will see $3,000 come. So that comes in, that amount is good enough to make a house for them. They get the protection, and the kid who was anyway dying of hunger there, so he would have a good access to food and everything. And that kid is happy also, and they get them brainwashed and everything. So if, like, you know, looking at that area, and I was a business manager in Pakistan, and one of the things I always kept on saying, I was there doing this leadership program at ICANN in Omaha, Nebraska, focus. And this first session was going on, and they said, it was at the time they're talking about $3.5 billion aid given to Pakistan. And the question was, should the United States give aid to these countries or not? And my turn came, and I made this statement. I said, please stop giving this money. And they looked at me. He said, what's wrong with you? You have forgotten you are Pakistani? He said, I have not forgotten. That's the reason I'm saying, please don't do this. Because this money, mostly this money goes into those corrupt pockets. Most of the money, very little get kind of spent onto the real thing. If you really want to help, open up some business there. Try to, even if you think that's a sunk cost, let it do. Let's open up some business there. People will get some job somewhere, and that is slowly they will come out of that poverty. Otherwise, if the poverty is there, this kind of a melting pot for all these bad things to happen. So you're coming back to your question, it's still a theory, it's still a thing they try this world to believe in, and nobody had said yes, nobody had said no. I personally do not believe in that. Yes? Thank you. Any other questions? Yes.
If you need to if you need to convince people using religion, wouldn't it be logical to have Muslim people go to the Muslim leaders to do the convincing?
Yes. Yes, that's exactly this technique was used. They actually went to how this institution of mosque works there. Here, obviously, if somebody wants to make a church or a mosque, what is the prereq? You have to have that. My understanding is you have to make an application to the government or the city government. The city government will come, have a look at this place, that this place is adequate, is it required? And then obviously after getting all those legal things done and settled, then one day you will start making this kind of church, temple, mosque, whatever, and then this place will come up. But then this place will always stay under the surveillance of the government or the city as a whole. Like my house is my house, but it is being watched by the city government also. I cannot leave my sidewalk with the snow on. I have to. So there's kind of laws which are there. In that part of the world, how mosque comes up. Most of these mosques, they'll see this empty piece of land, and probably somebody will come and maybe put a few bricks there, and after a while. So mostly there's government land. So mostly there's illegal occupants which are there. Even if it's a legal occupant, you need not get a permission from the government. You make this one structure, and this one man will actually end up, in most of the cases, will end up making a mosque by getting donations from different people. And this process of donation can go on for years at times. They'll build a mosque. Who is the owner or the custodian of that mosque? It's not an institution, it is this one individual who is there. That Maulvi, that religious leader, one, he is not answerable to the government. Two, that place, practically he owns that place, which he declares mosque. Three, he starts playing with the religious sentiment. And he creates this kind of what you call, the government cannot come and touch him. So he will go on to the loudspeaker, he will start throwing out sermon, and that's like, so what the government did, they started talking to these Maulvis individually and started selling them this concept that polio vaccination is not un-Islamic, it is not causing any harmful effects. Scientific evidence was shared with them, and on top of it, if there is some money which was obviously what you call in that part of the world, what you call a marketing expense, so some part of money was also given to them so that they start saying. So your point is so valid that that population was only listening to them. All the government efforts, all the logical things, they failed. It was only through these Maulvis that we had this first crack. Once you are able to create that crack, then you can flood in the area. Yeah.
I wonder if you can expand on something you covered really in there. Most every level of government is suspicious of the next level up from them, all the way down to cities, But yet public health is pretty much always done as top down. You talk about doing it at the local level. Because most public health, well, for example, when we were in Cuba, they run a very fine system, but it is very regimental.
Yeah.
So and sometimes it was not in the best interest of the public health.
Like I'll talk about public health system in Pakistan, and then we'll come to this part of the world. When we think about public health, the concept is really to make sure that disease ideally should not take place. This is an idealistic word, and even if the disease does take place, it is countered at basic level. And there in Pakistan we have this system, what they call is a rural health care system, where these rural centers, they are made at every 20 to 30 miles, depending on the population which is there, 10 miles. So there we have one primary healthcare doctor who is there, a small team who is there, who are there providing this free treatment to the population which is there. And if they think that this problem cannot be solved here, they go to this next level. Within that rural area, this is one area where they can actually have a small operation theater, 4 to 5 doctors, an obstetrician is sitting, gynecologist is sitting there, and then from that level, this is kind of primary healthcare. Then we have secondary healthcare. Secondary healthcare is what you call if you think about Omaha. So in Omaha, we'll have this one hospital, what we call district headquarter hospital, where cases are referred to that, and if things cannot be solved here, we'll ultimately have this tertiary healthcare, which will be mostly more like a Nebraska medicine which is there, or Creighton which is there, which is attached with a medical school, and you treat complex cases there. But the point is how this is more like a funnel. If you look at healthcare, it acts more like a funnel which is there.
That's how the funnel is. Unfortunately, when it comes to issues, the bigger part is here, where the problem starts. But when it comes to spending, we have reverted it. Now the trick is how we are going to get this 7% of primary healthcare or 8% of primary healthcare, one converted to 12 to 13%, 14% plus. Obviously, it will always cost more to have a knee replacement done than to tell somebody, please take exercise. Two is how we are going to get ultimately public health involved with that primary healthcare. That's a concept, that's an issue which is what we call these days, this is what my specialty is, community-oriented primary care. What we really are talking about, this is exactly the same model we said. You really have to understand the population. You cannot brush it with kind of a stroke for everybody. Somebody living in Omaha is different from somebody living in Bellevue, for somebody living in kind of Lincoln, and the list goes on. Just to give you an example, I'm doing my capstone at Charles Drew Health Center. And if you want some time point in my, I can just come and share the population dynamics which are there in northeast of Omaha. And you will say, no, Muhammed, you're not talking about our world. This is not our world. But reality is that is there. And the whole concept is go in, try to understand that population dynamics, kids, elderly, age groups, gender kind of divide which is there, and the things go on. Because to my mind, being rich is good. Being rich is great. I mean, it's a privilege which God give us. But point is, rich are not without problems. Rich have their own problems. So when I go to that community which is poor, I need to understand that community, and we need to tailor our healthcare spending according to that community. When we come to this rich community, we do the same. I mean, we will do it with different things. So like, for example, this is the healthcare center on Nebraska Healthcare Center on West Roads and 160th, 170th. The type of population which is there, mostly they're hypertensive, mostly they're diabetics. So if I keep on thinking about, I need to really think about diet issues, diet is not an issue. Even knowing the diet is not an issue. Issue is how I'm going to sit with this patient over and over and over again, keep on saying, work out, more vegetables, work. This has to go on. I mean, nobody likes vegetables. I don't think anybody likes vegetables. You see? But point is, this is my kind of project we have in my mind. I come from an area we use a lot of lentils, beans, and I have this thing because they came up, the people are poor, they cannot cook food because one, it's expensive, two, they don't, mostly they do two jobs, they don't have time. I said, all right, let's buy a slow cooker, which will cost $25 to $30, and we start running these lentil making classes. Throw lentils and few spices in it, go to the work, come back 10 hours later, the food is ready. So, but if I try to sell that lentil concept to somebody living in west of Omaha, he will look at me and say, hey, this man is crazy, forget. See, so different. So from that perspective, know the community, which is very important. Two is, make sure that you're talking about primary healthcare. This concept, the pill will come and fix it, the operation will come and fix it, that has to go away. Right now we have this kind of thing with us. And I don't blame general population for that. Just think through what medicine has done till date. You know what we as healthcare professionals can give to population? Honestly, infections, that's it. What other things? What we do for hypertension? Is there a cure? No. We give medicines to ensure that the hypertension stays at a certain level. We cannot cure that. Diabetes, we cannot cure that. Obesity, can we cure that? No. We tell them not to eat. Well, they won't be obese anyway if they don't eat. So what are you telling me? You see? The point is, that is how this evolution, we as a medicine, we are used to, I go in, sore throat, 7 days of medicine, oh my throat is good. Now, in United States, infectious disease load has gone down. And this chronic diseases load has gone up, which is #1 killer right now. How we are going to convince people that we don't have answer for these chronic diseases? It's only you have answer to those chronic diseases. It's a very strong admission that has to come from the healthcare team, and that's the way forward. Yeah. Yes, please.
Thank you for coming, by the way. It's really interesting. How is the Pakistani government, what's their stance on this? And is there some fear of crossing the Taliban as far as the polio issue?
Oh, okay. I wish if I can show you that video again, which was a promotional video. It was a huge concern for government of Pakistan when the polio started coming back. One is it's a serious health issue. Two, it's an image issue because that country, you are the only country in the world who has polio coming back. So what's going wrong? What actually the government was providing this armored force to those polio workers to actually go and deliver them. So government is on board when it comes to polio vaccination. It's just that the process is such and it's so elaborate and it's kind of what you call the tire is hitting the road all the time to achieve that. And access to those areas is very difficult. That is making this project difficult. So for government is concerned, they are on board. They really want to get rid of polio. And you know that like what happens if I have a vaccination coming from Melinda Gates Foundation. It's not only vaccine that comes, it brings in tons of Land Cruisers for that part. So here you drive Land Cruiser like in that part of the world, it's a huge status symbol vehicle. So a government official is enjoying that, and then they are having few trips here and there to United States and go back. So for them, it also makes sense. And you know, when you talk about aid and to talk to people, say, you know where the aid is going. So I said, obviously we need somebody to work there. So keep on, this. So they are on board because they are also a beneficiary of that thing. But just that, I kind of, I would say education. It's such a curse. Somebody is not educated, and they come to you and they talk, and no matter how, because as a physician you see very grave consequences. Somebody comes to you in the hospital and you're trying to talk to them. They don't understand. Not that they don't want to, they cannot. And they're sitting across very poor person having tuberculosis. Here you know, if you get a tuberculosis case in Omaha, it is kind of a notifiable disease and it becomes a huge issue. In Pakistan, if a patient is coming to me, we don't have very many tests, fever is not going down, start on anti-tuberculosis treatment, even without much of evidence. And in 90% of cases, they'll get all right. That's how prevalent tuberculosis is. So that tuberculosis, pulmonary tuberculosis, that is tuberculosis of the lungs, the patient is sitting in front of, he's poor, he's smoker. You tell them, please don't smoke. And you say, oh yeah, hanji, yes. He walks out, trust me, I've seen that, like they walk out, in that kind of hospital, he's smoking there, sitting there and smoking. He was there a minute ago in the clinic and he just walks out and is smoking. This is what lack of education does to you. It's a big issue. If people are educated, I'm a very strong belief, if people are educated in that part of the world, even these corrupt governments will find it very hard to sell what they keep on selling to them all the time. So right now, at times I feel bad in that country where 80% are poor. Then if you cross that kind of a percentage and you enter into that kind of top 10%, life is not good. Life is amazing. Because instantly the rest of the society is working for you. And if you are a corrupt official, you actually jump from 10% to that top 5%. And if you are a corrupt politician, you jump, or a army general, you jump from that top 5% to that top 1%. Life is amazing, life is good. The entire country is at your disposal, they are working for you, lot of servants, huge houses, car. So why somebody will actually deep inside bother to make sure that these people get educated, their level go up? Because if their level go up, your kind of this disposable, I would do apologize, that's a very bad terminology, but that's the terminology. This disposable human resource which is working for you all the time, that will vanish. So that's an issue.
Well, help me thank him for